decades in emergency rooms, and I need to be absolutely clear. Most individuals over 60, if alone, won't survive their initial heart attack. This isn't intended to scare you. It's a stark reality. Nearly half of all heart attack fatalities occur before the patient even reaches the hospital. The reason? Wasted time, hesitation, and panic. Many simply don't know the crucial yet simple steps that can maintain blood flow long enough for medical assistance to arrive. The brutal truth is, without this knowledge, you could be gone in mere minutes. Day in and day out, I've witnessed patients brought into my ER who could have lived if they had only acted differently at home. That crushing chest pain, sudden breathlessness, dizziness, and cold sweat, by the time they arrive, that critical window of opportunity has often closed. However, there's good news. There are scientifically proven techniques, straightforward actions you can take right now, even if you're completely by yourself, that can significantly boost your survival odds. These aren't fads or urban legends. They are legitimate strategies cardiologists teach their own patients. In this video, I'll guide you through 7 life-saving tips every senior must be aware of to survive a heart attack when no one else is around. These are the very steps I wish every patient in my ER had practiced before their attack. And just wait until you hear number 3. It's incredibly potent. Research indicates it can be the deciding factor between irreversible damage and walking out of the hospital alive. Most people are unaware of it, but after today, you will be. All medical references and scientific studies I mention will be listed in the description below. Before we dive in, a quick question for you. How old are you? Share your age in the comments. I personally read and respond to every single one, just as I would in my clinic, so please don't hold back. Now, without further delay, let's begin with number 7 on our list, the very first step that could determine if you make it through. Number 7, call emergency services immediately. Do not delay. The absolute first and most crucial action to take when you recognize the signs of a heart attack is to dial emergency services without hesitation. Don't wait, don't second guess, and don't tell yourself it might just be indigestion or that it will pass. With every passing minute, the damage to your heart muscle intensifies. Cardiologists simplify it: time equals muscle. The longer blood flow is obstructed, the more heart cells die, and the lower your chances of leaving the hospital alive. Research strongly supports this. According to the American Heart Association, patients who contact emergency services within the first 5 to 10 minutes of experiencing symptoms have survival rates up to 50% higher compared to those who delay. Yet tragically, many seniors minimize their symptoms. Studies reveal that almost 1/3 of individuals over 60 wait more than 2 hours before seeking help, often because they don't want to inconvenience anyone or they believe they can endure it. This hesitation can prove fatal. Consider this scenario. A 68-year-old grandfather in Ohio experienced a strange pressure in his chest one evening. He dismissed it as indigestion, drank some water, and sat down to rest. He waited for hours, hoping the discomfort would subside. By the time his daughter discovered him and called 911, the damage was irreversible. Doctors informed the family that if he had called emergency services immediately, he likely would have survived with minimal heart damage. This tragic story is replayed thousands of times annually, and it's entirely preventable. Therefore, if you're over 60 and ever experience crushing chest pressure, sudden shortness of breath, unexplained nausea, or that unsettling cold sweat, assume it's a heart attack until proven otherwise. Pick up the phone and dial emergency services without any hesitation. Even if it turns out to be indigestion, you've lost nothing. But if it is a heart attack, which it often is, you've just taken the single most vital step to save your life. Recognizing the urgency and making that call is the initial act of survival. However, while you await the paramedics, what you do next can keep your blood circulating and gain you even more precious minutes. This brings us to tip number 6, a technique proven to maintain oxygen flow when every second counts. Number 6, chew an aspirin if available and you're not allergic. Once you've contacted emergency services, your next action can be the decisive factor between life and death. Chew an aspirin. Don't swallow it whole, chew it. Why? Because aspirin isn't merely a pain reliever. It's one of the most potent clot-fighting medications you can acquire without a prescription. Heart attacks occur when a blood clot obstructs blood flow to the heart muscle. Aspirin functions by thinning the blood and preventing the clot from enlarging, thereby maintaining some blood flow until help arrives. The scientific evidence is unambiguous. A pivotal study published in The Lancet revealed that taking aspirin during a heart attack decreased the risk of death by 23% in patients. But here's the crucial point. Speed is essential. The quicker it enters your bloodstream, the faster it begins to work. Swallowing an aspirin whole can take 10 to 12 minutes to dissolve in your stomach. Chewing it breaks it apart instantly, allowing the active ingredient to be absorbed through your mouth and stomach lining within just minutes. In a situation where every second is vital, those minutes can preserve heart muscle and save your life. Consider the case of a 70-year-old retired bus driver alone in his living room when he experienced that crushing pressure in his chest. He recalled his doctor's advice, reached for the aspirin in his cabinet and chewed it while dialing 911. Paramedics later informed him that this simple action maintained his blood flow just enough to avert major heart damage. He walked out of the hospital 2 weeks later, alive and still independent. However, this is where many seniors make a mistake. They either don't keep aspirin in their home or they hesitate because they're unsure if it's safe. If you have an aspirin allergy, a bleeding disorder, or if your doctor has explicitly advised you against taking it, then skip this step. For everyone else, keeping a bottle of uncoated aspirin in an easily accessible location is one of the wisest emergency precautions you can take. Doctors typically recommend chewing one full 325 milligram tablet at the initial sign of a heart attack. Think of it this way: chewing that single pill is like dispatching a rescue team to mitigate the disaster until reinforcements arrive. It doesn't cure the heart attack, but it can prevent the damage from spiraling out of control. Acting swiftly with aspirin significantly increases your odds. However, surviving a heart attack alone isn't solely about what you ingest. It's also about how you move your body during those terrifying minutes. And that's where tip number 5 becomes critical. Number 5, loosen tight clothing and sit upright to reduce strain on the heart. When a heart attack strikes, every movement you make directly impacts the amount of strain your heart must endure. One of the simplest, yet most frequently overlooked survival actions is to loosen any tight clothing and sit upright. Seniors often underestimate how rapidly restricted circulation and poor posture can exacerbate an already critical situation. Tight belts, waistbands, or collars compress blood vessels, making it more challenging for your body to circulate oxygen-rich blood precisely when it needs it most. Sitting upright alleviates pressure on the diaphragm and lungs, facilitating easier breathing and reducing the workload on your already compromised heart. This isn't merely common sense, it's grounded in physiology. During a heart attack, your heart is working desperately to pump oxygen through narrowed or blocked arteries. Lying flat forces the heart to exert more effort, particularly in seniors with weaker lungs or pre-existing conditions such as COPD. By sitting upright, ideally at a slight recline with your back supported, you enhance airflow into the lungs, decrease internal chest pressure, and allow blood to flow more efficiently. A clinical review published in the European Heart Journal emphasized that positioning patients upright during cardiac distress helps reduce pulmonary congestion, essentially the accumulation of fluid in the lungs that creates a suffocating sensation. In essence, the way you position yourself can literally be the difference between gasping for air and maintaining enough composure to survive until help arrives. Consider a 74-year-old woman in Florida who experienced chest pressure while gardening. Instead of panicking and lying down, she moved to a chair, loosened her gardening apron and waistband, and sat upright while awaiting the ambulance. Her doctor later informed her that this decision likely prevented her from fainting and collapsing before paramedics could administer oxygen. That small adjustment prevented her heart from collapsing under the strain. It's such a simple step that many seniors overlook it, but it truly matters. If you experience those telltale signs, pressure, shortness of breath, or a cold sweat, sit upright, relax your shoulders, and free your chest and waist from any constriction. Think of it as providing your heart with room to breathe. This adjustment provides crucial stability. However, to further improve your odds, you need to ensure oxygen continues to reach your brain and heart when circulation is compromised. That brings us to tip number 4, a powerful physical action seniors can perform in those desperate minutes before medical assistance arrives. Number 4, cough strongly if you feel faint. It can temporarily maintain blood flow to the brain. It might sound peculiar, almost too simplistic, but in the midst of a heart attack, coughing, yes, coughing, can sometimes keep you alive long enough for help to arrive. Doctors refer to it as cough CPR. The principle is straightforward. When you cough deeply and forcefully, your chest muscles contract, your diaphragm compresses, and pressure builds within your chest. This pressure forces blood out of the heart and into the brain, helping you remain conscious when circulation is failing. Now, let's be absolutely clear. Cough CPR is not a substitute for medical treatment, nor is it a cure for a heart attack. However, it can buy you invaluable seconds if you feel faint, dizzy, or on the verge of passing out before paramedics arrive. Research published in the Journal of the American College of Cardiology demonstrated that repeated strong coughing during cardiac arrhythmias kept patients conscious and temporarily sustained blood pressure until emergency treatment could be administered. In some instances, patients were able to remain alert for several minutes simply by coughing every 2 to 3 seconds. Imagine this scenario. A 69-year-old retired mechanic in Texas felt a sudden wave of dizziness during what was later confirmed to be a massive heart attack. Alone in his workshop, he recalled hearing about cough CPR. He began coughing forcefully, repeatedly, and managed to stay conscious until paramedics arrived. Doctors later stated that those coughs likely prevented him from collapsing and suffering brain damage before they could restart his heart. The science behind it is simple. Fainting during a heart attack is caused by a sudden reduction in blood flow to the brain. By coughing vigorously, you create artificial heartbeats, almost like manually squeezing a pump with your chest muscles. It's not a perfect solution and won't stop the attack, but it keeps oxygen flowing to the brain long enough for medical professionals to take over. If you ever experience your vision narrowing, your head spinning, or your body feeling limp during chest pain, try this. Take a deep breath, then cough hard and strong as if you're attempting to clear your lungs. Repeat this every 2 to 3 seconds until the dizziness subsides or paramedics arrive. Think of it as manually keeping your heart in motion when it's struggling. This unusual but powerful technique has saved lives. However, once you've stabilized yourself, you also need to ensure oxygen is effectively reaching your lungs. That's where tip number 3 comes in, another simple yet life-saving habit every senior should master. Before we continue, if you're finding this video valuable, please tap that like button and make sure to subscribe and turn on the bell icon so you never miss out on powerful health tips like these. Number 3, unlock your door and keep your phone nearby so help can reach you quickly. When a heart attack strikes, every second is precious, not just for your body, but for the individuals attempting to save you. One of the most frequently overlooked survival steps is also one of the simplest. Unlock your door and keep your phone within arm's reach. It may seem insignificant, but in a crisis, it can be the difference between being discovered in time and being trapped behind a locked door while critical minutes slip away. Here's why this matters. Paramedics are trained to break down doors if necessary, but every additional barrier consumes time. And during a heart attack, time is muscle. Studies demonstrate that for every 10-minute delay in treatment, survival rates decrease by nearly 10%. Imagine losing those life-saving minutes simply because help couldn't reach you quickly enough. Unlocking your door in advance eliminates that risk. A 73-year-old widower in Arizona learned this lesson the hard way. He dialed 911 after experiencing severe chest pain, but collapsed on the floor before he could unlock his front door. Paramedics arrived within minutes, but had to waste precious time forcing their way inside. By the time they reached him, too much damage had already occurred. Contrast that with the story of an 80-year-old woman in Florida who unlocked her door, clutched her phone, and remained in a chair near the entryway. Paramedics gained immediate access, initiated treatment, and swiftly transported her to the hospital. She survived with only minor heart damage. The second part of this tip is equally crucial. Always keep your phone nearby, especially if you live alone. Too many seniors leave their phone in another room or plugged into a charger out of reach. During a heart attack, even walking a few steps can lead to collapse. Having your phone next to you ensures you can maintain communication with emergency responders until help arrives. Some even advise putting your phone on speaker so you can follow instructions without needing to hold it to your ear. Think of it this way: your phone is your lifeline, and your unlocked door is the bridge that gets help to you faster. Together, they eliminate barriers and recover time you absolutely cannot afford to lose. Once the path for help is clear, the next step focuses on keeping your body calm enough to survive until that assistance arrives. And that's where tip number 2 makes all the difference. Number 2, take slow, deep breaths to lower stress on the heart and oxygenate blood. In the throes of a heart attack, panic is your gravest adversary. When fear takes hold, your body activates its fight or flight response, unleashing a torrent of stress hormones like adrenaline. This reaction elevates your heart rate, spikes blood pressure, and forces your already struggling heart to work even harder. That's why one of the simplest yet most potent survival actions you can undertake is to take slow, deep breaths. Deep breathing accomplishes 2 critical objectives. First, it increases the amount of oxygen reaching your blood and brain, both of which are desperately in need of fuel when circulation is compromised. Second, it signals your nervous system to calm down, mitigating the surge of stress hormones that place additional strain on the heart. Research published in the Journal of Cardiopulmonary Rehabilitation and Prevention found that slow, controlled breathing reduced heart rate and improved oxygen delivery, even in patients with advanced cardiovascular disease. It's not a cure, but it gives your body a fighting chance while you await help. A 76-year-old retired nurse from Michigan recounted how she survived her heart attack by solely concentrating on her breathing. As the crushing pressure in her chest intensified, she resisted the impulse to panic. She sat upright, closed her eyes, and began inhaling slowly through her nose, exhaling even more slowly through her mouth. By the time paramedics arrived, she was weak but still conscious. Her cardiologist later informed her that those steady breaths likely reduced the workload on her heart and kept oxygen flowing to her brain long enough for treatment to commence. Here's how to perform it. If you ever find yourself alone and in danger, place one hand on your stomach, not your chest. Inhale deeply through your nose, feeling your belly rise. Then exhale gently through pursed lips as if you're blowing through a straw. Aim for approximately 6 to 8 breaths per minute. Slow, controlled, and deliberate. This type of diaphragmatic breathing not only assists the heart, but also keeps your mind focused when panic attempts to take over. Consider each deep breath as buying yourself more time. Time for oxygen to reach your brain, time for your heart to ease its workload, and time for paramedics to arrive. And if there's one more habit that seamlessly connects all these survival tips, it's the final and most crucial one. The action at number 1 that research shows can double your odds of survival. Number 1, stay as calm and still as possible. Movement can worsen damage during an attack. When a heart attack strikes, your initial instinct might be to move, to pace, or even to attempt to walk it off. However, that instinct can be lethal. The paramount survival rule is this: remain as calm and still as you possibly can. Every step, every sudden movement compels your weakened heart to pump harder. And during a heart attack, your heart is already battling for its very existence. By keeping your body still and calm, you diminish the strain, conserve precious oxygen, and grant yourself the greatest chance of surviving until help arrives. Scientific understanding illuminates this clearly. During a heart attack, blood flow through the coronary arteries is either completely blocked or severely restricted. Movement demands more oxygen from the heart muscle, but with its supply compromised, that additional demand only exacerbates the damage. A clinical study published in the European Heart Journal discovered that minimizing exertion during acute coronary episodes reduced complications and improved patient outcomes. In simpler terms, seniors who remained calm and still lived longer than those who moved around in a state of panic. A 71-year-old farmer in Nebraska experienced this firsthand. While repairing equipment, he felt a crushing pressure in his chest. His first thought was to climb back up the ladder to retrieve his phone. Instead, he forced himself to stay put and called for help from where he was. Paramedics later told him that remaining still prevented his heart from collapsing under the stress. He survived with significantly less damage than doctors had anticipated. Calmness isn't merely physical, it's also mental. Panicking floods your body with adrenaline, elevating blood pressure and intensifying the attack. By concentrating on staying still and practicing slow, deep breaths, you reduce that hormonal surge and help maintain your body's stability. Tell yourself, I've called for help. My sole responsibility now is to stay still and breathe. This mindset prevents impulsive decisions, such as attempting to walk to the door or grab something across the room, actions that can trigger collapse before help arrives. Envision your heart during a heart attack as a fragile engine running on fumes. Every movement revs the engine faster and risks causing it to break down. Stillness, calmness, and conserving every ounce of energy are paramount to buying time. This is the ultimate, most powerful habit. Do less, breathe more, and allow help to reach you. Together, these 7 tips form a comprehensive survival map. And while you cannot predict when a heart attack might strike, knowing precisely how to react can be the crucial difference between tragedy and survival. And there you have it, 7 life-saving tips every senior must know to survive a heart attack alone. From immediately calling emergency services to chewing aspirin, loosening tight clothing, coughing when faint, unlocking your door, taking slow breaths, and finally, remaining completely calm and still. Each action secures you precious minutes. Minutes that can mean the difference between life and death. Remember this, A heart attack doesn't always offer a second chance, but if you act swiftly, think clearly, and adhere to these steps, you can survive and live to see another day. The science is undeniable, but it only works if you are prepared to act. Now, I'm eager to hear from you. Where are you watching from? And do you keep a Spiron or another emergency plan readily available in your home? Share